Have you ever thought about what would happen if your body's own defense system started attacking you? Well, today we're diving into exactly that. We're talking about rheumatoid arthritis, a condition that's often misunderstood but affects millions of people. And to really get what it feels like, let's start with someone's story. Meet Sarah. Imagine waking up every day with stiff, aching hands. Not just one, but both. And it takes over an hour just to get them working properly. On top of that, you're just bone tired all the time. These aren't just random aches and pains. These are clues. So what in the world is going on here? Well, the culprit behind all this isn't some bug she caught or an injury. The intruder is actually coming from inside her own body. It's an inside job. So let's define exactly what this is. Okay, so what is rheumatoid arthritis, or RA for short? It's an autoimmune disease. Now you know your immune system, right? It's supposed to be your bodyguard, fighting off germs and keeping you healthy. Well, in RA, its wires get crossed. It gets confused and starts attacking the lining of your own joints. It's a classic case of friendly fire. This attack causes constant inflammation, which is what leads to all that pain, and if you don't do anything about it, permanent damage. And this is not some super rare thing. About 1% of the entire world's population is living with it. Now, 1% might not sound like a huge number, but think of it this way. If you're in a room with 100 people, odds are at least one person in that room is dealing with this every single day. And here's something else. RA doesn't play fair. For every one man who gets it, 3 women do. Yep, a 3-to-1 ratio. We're still working on understanding exactly why, but it's a massive difference, and it typically shows up for the first time between the ages of 30 and 50. So how do you even spot this early on? The clues are actually pretty distinct. The pain is usually symmetrical, so if one wrist hurts, the other one does too. It's both hands or both knees. A huge red flag is morning stiffness that lasts for more than 30 minutes. We're not talking about just feeling a little creaky. And maybe the biggest clue of all, it's not just about joint pain. It's a deep, overwhelming fatigue that just drains you. Okay, so recognizing those signs is step 1. But after that, the real detective work starts. Let's dig into how doctors actually crack the case and figure out if it's really RA. The whole process is actually pretty logical. It all starts with the doctor just listening to your story, all those symptoms we just talked about. That's the clinical suspicion part. Then they'll run some blood tests to look for very specific markers of inflammation. And finally, they might use things like X-rays or ultrasounds to get a literal look at what's going on inside your joints. But, not all blood tests are created equal. This is where the clues get really specific. These tests are looking for antibodies, tiny proteins your confused immune system is making. This chart compares the 2 main ones, rheumatoid factor, or RF, and something called anti-CCP. What you really want is a test with high specificity, which just means it's really good at being negative when you don't have the disease. It helps avoid false alarms. And as you can see, that anti-CCP test is way more specific, which makes it a much more reliable clue for doctors. So here's the bottom line. The rheumatoid factor test can sometimes pop up positive for other reasons, but a positive anti-CCP test, that is highly specific for RA. It's the closest thing to a smoking gun in the whole diagnostic process. It also often tells doctors that the disease could be a bit more aggressive. All right, so the diagnosis is confirmed. This is where everything shifts. The clock officially starts ticking, and this part is a genuine race against time. It's absolutely critical. In the world of RA, there's this vital concept called the window of opportunity. It's a short, precious time frame right after symptoms really get going. And if you act decisively within this window, you can literally change the entire future for someone with RA. You can stop the kind of joint damage that you can never undo. So how long is this window? Just 12 weeks, 3 months. That's it. From the start of persistent symptoms, that's pretty much the deadline for starting an effective treatment. Missing this window can be the difference between living a full mobile life and dealing with irreversible damage. So, the diagnosis is in, we know how urgent it is. Now it's time to fight back. Let's break down the comprehensive battle plan for managing RA today. Today's treatment strategy has multiple layers. The foundation is a class of drugs called DMARDs. It's a mouthful, but what they do is simple. They actually slow the disease itself down. For more severe cases, we have biologics, which are these incredibly targeted therapies. And for managing short-term flare-ups, there are corticosteroids, which are powerful and act fast to calm inflammation. Now, within that first group, the DMARDs, there's really one that stands out above the rest: methotrexate. It's known as the gold standard for a reason. For most people, this is the first-line medication, the cornerstone that the whole treatment plan is built on. But the battle plan is not just about medication, not at all. Lifestyle changes are just as crucial. The number one thing? If you smoke, quitting is the single most powerful environmental factor you can control. After that, low-impact exercise to keep joints moving, a healthy diet to help reduce inflammation, and, of course, support for the mental and emotional side of things. They are all essential pieces of the puzzle. So with a solid plan in place, the focus starts to shift. It goes from crisis management to long-term well-being. It's all about finding a new normal and really living a full life with RA. And this leads to a really crucial point. RA is not just a joint disease. That chronic inflammation can affect your entire body. For instance, all that inflammation running through your system drives up the risk of cardiovascular events, we're talking heart attack and stroke, by a staggering 50% compared to someone without RA. These related health issues are called comorbidities. Because of the inflammation and sometimes the treatments themselves, people with RA are also at a higher risk for things like osteoporosis and even depression. It just shows that managing RA properly means taking a holistic view of a person's entire health. So let's circle all the way back to Sarah, from the beginning. Remember her story? The painful, stiff hands, the fatigue? Well, because her symptoms were caught early and she was able to start treatment quickly, that gold standard methotrexate, within 3 months, she was seeing huge improvements. She was getting back to her life. Sarah's story just perfectly highlights the two paths you can go down. Without that early action, the road often leads to permanent joint damage and disability. But with it, the goal is to preserve function, lower the risk of all those other complications, and live a full, active life. It's a night and day difference. Look, if you take just one thing away from this whole explainer, let it be this. The story of what it means to live with rheumatoid arthritis has been completely rewritten. We now know that recognizing it early and managing it proactively can totally change the outcome. Which brings us to a final thought. Knowledge is the first tool in any battle plan. So now that you can recognize the signs and you understand the urgency, what do you think is the most important first step anyone can take to grab control?